Hey folks, it's Dr. Sam, and I want to talk to you today about macular degeneration. So if you've just been to your eye doctor and you've been diagnosed with macular degeneration, usually you're told it's an aging issue, there's not much you can do about it, and we'll just watch it. So the macula is the part of the eye that contains something called cones. These are photoreceptors that help us with facial recognition, seeing detail, and distinguishing color. Now inside the macula, there's actually a yellow pigment, and this is called zeaxanthin. And surrounding the macula is another carotenoid called lutein. These carotenoids help protect your macula against the damaging sunlight, the ultraviolet, from the sun, and also blue light that's emitted from digital devices. So in terms of improving macula health, I want to give you several strategies. But before I do that, I want to talk about some of the causes. One of the main causes is actually cataract surgery. And cataract surgery is a great surgery. It usually works really well. But the plastic lens that they put in your eye does not have protection against the blue light from digital devices, and blue light can damage your macula. So you want to make sure that if you've had cataract surgery, you're protecting your maculas. Second reason why we develop macular degeneration could be because of pharmaceutical use. If you're taking drugs like statins or steroids, antihistamines, antidepressants, check in with your doctor because these pharmaceuticals could be having a negative effect on your macular health. Number 3 is oxidative stress. So in dry macular degeneration, the macula is drying out, and in wet macular degeneration, you're producing very shaky blood vessels behind the macula. In both cases, you're not getting enough nutrients into the macula, and this creates metabolic waste, and you're not able to get rid of it, so it accumulates. So this is where you want to start thinking about improving your diet, and I'll talk about that in a minute, especially getting carotenoids in the macula area. All right, the next reason why we might be developing macular degeneration is because of vascular disease. So if we're suffering things like diabetes, hypertension, there's even now a link between Alzheimer's and developing macular degeneration. So vascular disease, we're not getting enough circulation to the eye, especially the macula area. This is something to take a look at. Inflammation. So if you're getting problems with digestive issues, or you're not absorbing your food properly, or you've got an inflammatory response, you want to deal with that because that also could increase oxidative stress. And then using the computer. If you're using progressive lenses or bifocals and you're only using a tiny part of the lens, this is putting incredible pressure on your macula to have to do all the focusing. And eventually it's going to wear out. Okay, so here's some of the strategies. Lifestyle and diet are at the top of my list. So reducing stress, getting 30 minutes of aerobic exercise every day, wearing blue blocker lenses, sunglasses that have ultraviolet blocking capability, making sure you're eating an anti-inflammatory, mostly plant-based diet with lots of colorful fruits and vegetables. Remember your carotenoids, your nuts and seeds, so getting a lot of fats and oils in your diet as well. These are really essential ingredients in protecting your macula and or neutralizing some of the degeneration, and in some cases, maybe even improving it. So the thing I want to leave you with is you don't have to live out your doctor's diagnosis. There are many things that you can do. Even if you have been genetically tested positive, there's still some things you can do to improve macular health. Well, that's my message for today. I want to thank you so much for tuning in, and until next time, take good care.